And welcome to the Rational Living Show. I'm your host, Dr. Aldo Pucci. This is a special edition of the Rational Living Show. And we're just wanting to test some things out to make sure that everything's working well. And so I thought I'd take this opportunity to talk about how rational living therapy is different from other approaches to cognitive behavioral therapy. And remember, if you're listening in on the Podbean app, please feel free to call in with the Podbean app. We can answer any questions that you have. And if you are watching on YouTube or X or Facebook or LinkedIn, you can type in your questions. I'm glad to answer any that you have. Rational living therapy is a form of cognitive behavioral therapy. The main recognized forms of cognitive behavioral therapy are rational living therapy that I developed, rational emotive behavior therapy, which is the original approach developed by Albert Ellis, rational behavior therapy developed by Maxie Maltzby Jr., who was my mentor, and cognitive therapy developed by Aaron Beck. The cognitive behavioral therapies do have some similarities, including they are all based on the cognitive model of emotional response, meaning that our thoughts cause our feelings and behaviors, not people and things and situations. They are briefer and time limited. They emphasize a collaborative effort between the client and the therapist. We both have our role in the therapeutic success. Also, another similarity is utilizing a Socratic method. Being based on an educational model, the cognitive behavioral therapies are an instructive approach. Relying on the inductive method, meaning that we encourage our clients to view their thoughts as being hypotheses to be tested rather than a theory or a guess. And also emphasizing homework. All the cognitive behavioral approaches that I'm aware of emphasize making use of the time between sessions. Very important. However, rational living therapy does differ from other approaches to cognitive behavioral therapy in the following ways. First, rational living therapy is a very systematic and structured approach. There is a system to the therapy. The teachings each build on each other, and it makes good therapeutic sense. Also, the sessions are structured, which allows for efficiency and to make certain that we get the work done. Whereas other approaches to CBT are not particularly systematic, and the sessions are not necessarily particularly structured. Rational living therapy is also based on and exclusively utilizes behavioral and learning theory and techniques. Other approaches to cognitive behavioral therapy are virtually all cognitive with no behavioral component to them. Rational living therapy originated and developed the rational living therapy behavioral loop model that I teach to therapists. Another difference between rational living therapy and other approaches to cognitive behavioral therapy is that rational living therapy rejects psychiatric diagnostic labels and the medical model. Its main diagnostic concern in rational living therapy is whether clients presenting emotional and behavioral problems, whether those problems are primarily learned or not learned, the result of thinking as opposed to the result of a problem in the person's physiology. Psychiatric diagnoses, the problem with them is that they give both the client and the therapist the impression that the client has a disorder, and that that disorder is what is making the client feel and act as they do. For example, if a client is diagnosed as having borderline personality disorder, that diagnosis will give the client the impression that borderline personality disorder dwells within them, and it's this disorder that's causing them to feel and act the way they do. Instead, the diagnostic labels are just a label for a set of behaviors, a set of thoughts, a set of actions that are typical for the person. Also, rational living therapy's ABCs of emotions explain or describe a person's reaction to anything. The RLT ABCs can be applied to any reaction. Other approaches, ABCs, like the ABCs of rationally motivated behavior therapy, are used as a therapeutic tool and reserved for unwanted emotions and behaviors. Rational living therapy also teaches that there are three emotional options, not two. And the only two cognitive behavioral therapies that I know that who intentionally teach that are Maxi Maltby's rational behavior therapy and rational living therapy. Rational living therapy also rejects the concepts of self-esteem and self-acceptance, which certainly departs from other approaches to cognitive behavioral therapy. Rational living therapy believes that the concept of self, as in self-esteem, is so vague that it's useless therapeutically. Additionally, the concept of self tends to lead to overgeneralization. I like myself, I don't like myself, as opposed to I dislike certain things about me. I like certain things about me. Finally, since we are stuck with ourselves, it is impractical to reject ourselves. How can we practically reject ourselves? When you reject others, you probably have nothing to do with them. But how can you have nothing to do with yourself? It's just not practical. Therefore, we cannot help but accept ourselves. Rational living therapy replaces self-esteem and self-acceptance with the 4 A's, the accurate assessment of attributes and abilities. Rational living therapy also rejects common erroneous labels for emotions. It is very precise about emotive labels and the distinction between evaluations and emotions, whereas other approaches to CBT appear to be unconcerned about this distinction. For example, many people say, I feel inadequate. Inadequate is not a feeling. It is an evaluation or a thought. I think of myself as being inadequate. The therapeutic approach called DBT, or dialectical behavior therapy, for example, talks about feelings of worthlessness. However, we teach in rational living therapy that there is no such feeling as worthless. That is an evaluation. I am worthless, which is a thought. Rational living therapists emphasize this because human beings do not dispute feelings. We only dispute thoughts. So therefore, if a person says, I feel hopeless or I feel worthless, they will not attempt to dispute those thoughts because they label them a feeling any more than you would try to dispute whether or not your toe hurts if you ran it into a chair, right? And so therefore, we're very precise with the labels we use for emotions. Rational living therapy, another distinction, is rational living therapy integrates hypnotherapy theory and techniques. Not only does rational living therapy utilize techniques at times, the rational hypnotherapy techniques at times in the therapeutic process, but it also integrates it theoretically in terms of how people learn thoughts. People often learn problematic thoughts through unintentional hypnotic episodes. Another distinction between rational living therapy and other approaches to cognitive behavioral therapy is that rational living therapy revolves around the fact that you cannot have a practical problem without having a goal. RLT revolves around that fact. Often through rational living therapy, people who make themselves miserable about things that discover that those things are not even problems for them. They're upset about the idea of it rather than the actual consequence of it. Another distinction between rational living therapy and other approaches to CBT is that rational living therapy utilizes persuasive techniques to benefit the client. Clients often resist therapy because they are convinced that their thinking is correct. Most approaches to cognitive behavioral therapy do not have techniques to utilize systematically to help the client overcome the resistance so that they can get well. But thankfully, in rational living therapy, we have these persuasive techniques to help the client to at least consider that their thinking might be incorrect. If you'd like to learn more about rational living therapy, I encourage you to visit Rational Living Therapy's website, the home of Rational Living Therapy, and that is rational-living-therapy.com. That's rational-living-therapy.com. The Rational Living Show with your host, yours truly, Dr. Aldo Pucci, airs live every Wednesday at 7 p.m. Eastern United States time. So I encourage you to watch our show and to share it with others. And so I encourage you to also share it with your therapist if you have a therapist. It might be helpful to them. All right. Well, thank you all for watching, and I look forward to seeing you next Wednesday, 7 p.m. Eastern United States time.